Drafting of standard operating procedures, also called SOPs, it's an important tool for effective functioning of ethics committees. Once drafted, these SOPs have to have an institutional authority for effective implementation. There can be many ways by which SOPs can be regularized within an institution for giving its authority. We will now see two member secretaries discuss two important issues around these SOPs. First, they are going to discuss drafting and regularizing SOPs within an institutional framework. Secondly, how are required changes, revisions to SOPs are effected and regularized.
Hi, ma'am. How are you?
I'm fine, sir. This meeting seems to be going very well.
Yeah, the arrangements were done very means in a nice way.
Yeah.
The things are going well. I just want to ask you, how does the SOP get drafted in your institutional framework and as well as regularized?
Sir, actually, we draft the SOP, the ethics committee, some members form a subcommittee and we draft it. And once that SOP is drafted, we send the SOP through the director. It is presented in the ethics committee, and ethics committee members, others will give some revision. We also display it on our institute website for a specified period, usually 2 weeks, for comments to come from researchers. Then all this is folded into the SOP, and then we send it through the director to the governing body of the institute, which then will approve directly or give amendments to that in keeping with whatever they think. Then it is tabled before the IEC for adoption, and that the IEC adopts again. But its authority comes from the governing body, sir. That is how we do it in our institution.
Yeah, in our institute, the director nominates the SOP committee and they convene and draft all the SOPs. Once drafted, it goes to the ethics committee members of, means through circulation. We send by email as well as we send the hard copies also for inviting comments. And after getting comments, we incorporate all those things and we formally present to the ethics committee members as well as to the scientists who are investigators in our institute. Once again, if we get any comment, we incorporate all those comments as well as we revise and we get the approval from the ethics committee chairperson as well as from the director. Once it gets signature in the SOPs, means it is meant that it's implemented.
It is implemented.
Yeah, the implementing means responsibility lies with the secretariat.
Okay. For us, if you see nowadays, newer and newer, guidance is coming, legal guidance, also ethical guidance are getting issued. So there is always a need for the SOP to be amended, revised. Some things which were there, you need to add, sometimes we need to change. How do you manage that?
Yeah, if the government or any other body gives any guideline, the member secretary is a part of the national group which shares all the guidelines and as well as the notifications and other things with all the member secretaries and members of the committee. If I get any such guideline, then I immediately propose a revision. Means there's some template in our ethics committee SOPs. I use the template and I present to the ethics committee, and once it's agreed by the ethics committee, then I propose the revision to the director. He again nominates a group which is a committee of scientists as well as it may contain members also. Then the committee convenes and revises the SOP and the revision is circulated to among the scientists as well as the ethics committee members. Once finalized, it's approved by the chairperson as well as by the director and immediately gets implemented.
So your procedure is very similar to drafting the revision process also.
Yes.
For us, revision processes, once there is an identified need, usually the member secretary notifies. Sometimes some other members of the ethics committee also notify any required changes in the SOP in the meeting. Once it is noticed, within the ethics committee itself, a subcommittee is nominated. In that minutes we will write that this is the subcommittee for making these amendments to the SOP. Then that committee will meet. A date is decided, we meet. And the SOPs, revisions to the SOP are drafted. So in the immediate next meeting, it will be tabled in the ethics committee. Then once it is accepted by that committee that these revisions are needed, then it will be displayed for 2 weeks or so in the website of the institute for researchers to give comments. Then those revisions, the member secretary or somebody has to put into the revisions to the SOP. Then once this is accepted in the forthcoming meeting, it is sent again through the office of the director to the governing body. But we have one advantage. It doesn't have to wait for the next governing body meeting. What happens is the president of who is the head of the governing body, the chairman of that governing body, is authorized to sign any amendments, and then it will get ratification in the next governing body. But we can start implementing from the moment it is signed by the president of the governing body. So that way, the time between when the SOP is revised and it has to be implemented, we reduce, because governing body meetings happen not very regularly, once in 6 months or something. So rather than waiting, we can do this faster. So that is how we manage.
Yeah, I understand now. It's very clear. I can understand your institutional procedures and how different it is from our institutional procedures. And very good.
Yeah, but it's useful to know that there are many different ways of achieving.
Angles, yeah.
But it's important that SOPs are in some way given the authority within institution, and that is very important.
That is important.